A 30-year-old man is brought to the emergency department after being found unconscious in public. An EKG reveals ST elevations in leads 2, 3, and AVF. After appropriate treatment is given and the patient regains consciousness, the patient is informed of his condition. He asks to leave the hospital, explaining he has a schedule he needs to keep to for his work. The physician believes that the patient is not yet stable enough to be discharged. Which of the following is the next best step? Choice A, emphasize to the patient the severity of his condition and consequences of early discharge. Choice B, ask the patient the details of his work and if he can adhere to his schedule while hospitalized. Choice C, offer the patient a discharge against medical advice. Choice D, commit the patient against his will. Choice E, offer the patient a second opinion from another physician. I'll wait 5 seconds and answer the question. So once again, we have one of these ethics questions, which is really just a basic testing of your knowledge of autonomy. In some ways, questions like this are pretty much just common sense almost. Usually, you want to check if the patient has capacity, if he understands his condition, if he's been informed properly, and in this case, if accommodations can be made for the patient before moving on to discharge against advice. So, as mentioned in the question, he's already been informed of his condition. So, choice B is the patient details of his work, and if he can adhere to his schedule while hospitalized is the correct answer. Not much to say here, right? It's actually a very straightforward question, but ethics questions tend to be like this a lot of the time. They can't test you on overly complex situations because that's too controversial. So, looking at some of the wrong answer choices here, choice A, emphasizing to the patient the severity of his condition. I mean, it's two things. First of all, this is arguably too paternalistic. You really don't want to do that. Or any answer choice that feels like it's almost threatening the patient with his condition. These are usually hallmarks of wrong answer choice. And here it's also the fact that we already told you that he's been informed of his condition. So unless there's some kind of indication that he doesn't have capacity, this just isn't really a good answer choice. Choice C, offer the patient a discharge against medical advice. I mean, obviously, this is premature. You want to explore other options first. Choice D, commit the patient against his will. This step is only taken for patients who lack decision-making capacity or they pose an imminent danger of some kind. I don't think I've ever actually seen this as a right answer on step one. But if it was, it would usually need to be a patient that either displays an obvious inability to have decision-making capacity, or possibly they're suicidal, or they pose an imminent danger in the sense that they are on angel dust or something, which overlaps with the whole inability to make decisions, right? Like I said, it doesn't really seem to come up as a correct answer choice. Choice E, offer the patient a second opinion from another physician. Aside from the fact that this patient hasn't really asked for anything like this, but I've said it before, on USMLE answer choices, which defer responsibility to another practitioner, whether it's a referral or a consult or referring to legal advice, that sort of thing, they're pretty much always wrong. I mean, there's some rare instances where it could be right, but usually, if you think about it from the test writer's perspective, these sort of answer choices don't really make sense because they're here to test you, the physician, on what you're supposed to do, not your ability to refer to other physicians. So bringing it back, it's just a basic autonomy question, right? Just know you have to assess the patient's decision-making capacity, and then after that, you have to respect their autonomy. And don't be overly paternalistic. Don't threaten the patient. Like I said, sometimes it almost feels like common sense in a way. Hope you found this video helpful. See you in the next one.